A female of 32 years old presents with dysuria. She states that 2 weeks ago she made a urine analysis at the recommendation of her family physician. This one turned negative. The suprapubic pain that was present 2 months ago becomes especially prominent when she has intercourse with her partner. Although the physician prescribed NSAIDs previously, they do not calm the pain. The patient's history is remarkable for fibromyalgia. What is the best next treatment? Amitriptyline, corticosteroids, codeine, or ciprofloxacin? This patient has a negative urine analysis. She has pain at the level of the bladder that becomes prominent with intercourse. They do not cease with NSAIDs. Also, she has fibromyalgia. This clinical presentation is typical for interstitial cystitis. As we know, interstitial cystitis is exclusion diagnosis. Therefore, the treatment is usually symptomatic. But if the patient is resistant, such in this case where NSAIDs do not work, we go for amitriptyline. If the patient had UTI, she will present not only with dysuria, she will have a positive urine analysis. She would have leukocyte esterase and nitrates positive on the dipstick. In the case of cervicitis, she might have also discharge. Also, in the question stem, we would not have treatment of NSAIDs by the physician. He will never prescribe NSAIDs for a suspicion of UTI. He will prescribe instantly ciprofloxacin. On the other hand, this patient has only dysuria. She has pain with intercourse. She has a chronic pain condition, namely fibromyalgia. This is why we suspect an interstitial cystitis rather than UTI. This is synonymous with chronic painful bladder. It is exacerbated by exercise, intercourse, or alcohol. It is associated with psychiatric conditions or chronic conditions such as fibromyalgia. The diagnosis is based on clinical findings. Urine analysis is negative and symptoms are present for more than 6 weeks. The treatment revolves around avoiding the aforementioned triggers. If the symptoms are refractory, we use amitriptyline.